Okay, so can you all see my screen?
Yes, perfect.
Okay, perfect. So now that you have taken how to develop the brief itself, the problem statement, your underlying factors, the options, and all of that, now we're going to go into developing a policy dialogue. So what exactly is a policy dialogue? And it's one of the most interesting, in fact, sections of the knowledge uptake phases, because it allows you to inform the stakeholders, to get all the stakeholders together to discuss the topic at hand. Has any one of you been part of any policy dialogue, any stakeholder engagement discussion?
Yes, I have involved in the it's like a policy fair. It's, but it's related to early childhood education.
Okay, okay, interesting. Agus, you wanted to say something?
No, I just want to say that I have now joined the dialogue, the policy dialogue before.
Okay, so now we're going to discuss how a policy dialogue is usually conducted. Some facilitation tips, just in case at any point in your brief development you wanted to conduct later on a policy dialogue. Definitely you will need more coaching and mentoring from the institution, but just to give you an idea of what can happen in a policy dialogue, what can go wrong, what can go right, and how can we make sure that we do not have any barriers in the development of the policy dialogue. So a policy dialogue, it increases the interest. There's in fact a huge increase in interest in using policy dialogue. Why? Because there's a need for it locally to contextualize decision support. As you may know, sometimes we develop decisions, we develop options, recommendations, but they're all based theoretically. And that's the issue, because when it comes to real life experience and on-ground experience, it comes to a point where you stop and listen to it and it doesn't make sense, because there are many barriers to it, to the implementation. It's you haven't involved stakeholders in its development. It's all based on theory. We got it from another country. So it's very important to contextualize those decisions, those options. Also, research evidence is only one input into the decision-making process. So you always need those decisions that are taken by or developed by the evidence to be supported by what the stakeholders provide you as tacit knowledge from the on-ground experience. And based on that, you can come up with an actual contextualized decision that can be implemented. Many stakeholders can add significant value to those processes. So you might suggest, for example, in tuberculosis, to have awareness sessions in a certain community. But then again, a stakeholder might come and tell you, but they don't even know what tuberculosis, for example, means. So in this awareness session, you need to start by defining tuberculosis. Also, maybe you are addressing a topic that is very ethical and is not accepted by the community. So the stakeholders will inform you that this might not be taken well by the community, so you might want to change it, to reframe it in a way where the community will accept it. Also, the stakeholders provide you, policy dialogues provide stakeholders with a chance to take decisions. So once you get your options to the table, you might, stakeholders might come up and say, well, I will take upon a certain option. I can implement or integrate education on tuberculosis within the educational system or the university, for example. So this is an action taken based on a policy dialogue. Policy dialogues represent a new and evolving approach supporting evidence-informed policy making. So convening policymakers, stakeholders, civil society, researchers to deliberate on a pre-circulated brief will really inform the stakeholders into allowing them to indulge into the tacit knowledge and on the research evidence to make the decisions that they need. So a policy dialogue usually has multidisciplinary stakeholders that come together in making those or discussing the information. And why do we do that? Because usually policymakers have a certain approach of thinking how decisions need to be done, or they have their own environment to think about. For example, you have the educational system might think of something else when it comes to the option that you're providing. Researchers have their own way of thinking. So getting all of those together would really inform the decision-making process and the options that you have in mind. So those are just examples of some of the policy dialogues conducted at K2P. We have also conducted a focus dialogue with the center in Indonesia on to inform policymakers in two ministries, but it was more of a focused dialogue rather than a full-fledged policy dialogue. We have done policy dialogues on palliative care, on child protection, emergency medical services, and each of those dialogues had their own list of stakeholders. You definitely cannot get the same stakeholders to every single topic. Each of them have very specific targeted stakeholders that you would want to have in a policy dialogue. Usually policy dialogues have around 25 stakeholders. We try not to go beyond that because then it's going to be very tough when it comes to facilitating the policy dialogue. So let's just look at this picture. I will move to the second picture because it's clearer. This is usually the setting where a policy dialogue takes place. Usually it's a U-shaped table. You have on the head of the table, the facilitator. In this case, it is Dr. Fadi Jardale in one of the policy dialogues. Right aside him is the collaborator. So in this case, we had the collaboration with the Ministry of Health. So that's why we had the Ministry of Health sit right next to the facilitator, because usually the collaborator has been supporting the development of the policy brief. They might not have additional input to provide you during the dialogue, but you would also want to give them value also because they have extensively collaborated with you. They have also provided a lot of information. So just to give them a bit of value, we usually let them sit on the head of the table too. And then you have all of the stakeholders sitting on both sides of the tables. This setting, I'm concentrating on that because it's a make it or break it in a policy dialogue. The way you seat the stakeholders in a policy dialogue is usually a very important aspect of how the policy dialogue will go. For example, if you have two ministries, for example, the Ministry of Trade and Ministry of Economy, they don't get along together. You really would not want them to sit facing each other, because once one of them talks or says something, the other one would fire back. You would also want to have one stakeholder from each institution sitting on the table. You would also want to ensure that if two people from the same institution come to the dialogue, you need to make sure they're not sitting next to each other, because you will have side talks, they will not be concentrating on the discussion and all of that. So those are very important aspects to think about when it comes to a policy dialogue, and we will also discuss other further points on the policy dialogue. This policy dialogue had the Syndicate of Hospitals, for example, the Order of Nurses, we had academics, we also had physicians, we also had nurses who work on the field, the head of a hospital that is a governmental hospital, a private hospital. So there was a mixture of different stakeholders. There was the Red Cross also, and we were discussing the emergency medical services topic in this dialogue. So those are other pictures of some of the dialogues. And remember, policy dialogues are very important for the reason that sometimes you might be working on a topic, finalize it. During the policy dialogue, a stakeholder might come up and tell you, well, this is very important, but one of the options would fit into another knowledge translation product. So we usually got requests to develop other knowledge translation tools, such as policy briefs and briefing notes, during the dialogue itself. So, so it's very important also to keep that in mind. First, one of the policy dialogues that we have was on medical errors. And during the discussion, there was a discussion that one of the reasons for medical errors is because we don't have standardized standards for hospitals, for primary healthcare centers. And that was one of the options that we suggested in the policy brief. But we also had the Lebanese Red Cross, which usually transports patients from hospital to hospital, from their house to the hospital, and all of that. And they said, well, you're considering only hospitals and primary healthcare centers, but there's also a need for standards for emergency medical services. And that's how we moved on to develop another knowledge translation product on emergency medical services, which also tackles developing quality indicators and quality standards for emergency medical vehicles also. So keep that in mind. Policy dialogue, although it's the end product of the policy brief itself, but it can also open up other Pandora boxes for other knowledge translation products. Is everything clear until now? Do you have any questions before I move on?
Ada pertanyaan, Bapak-bapak?
Yes, Clara, I have a question. When we conduct a policy dialogue, like you say, maybe the policymaker will have another view about our presentation, that
yes.
It could be that our presentation is not in line with what they are expecting. So what should we do about that? Should we go back and change our policy brief that we already have, or should we invite them to have more in-depth discussion to determine the option that is in line with their program?
Yeah, very good question. And this is very important. Usually you don't get stakeholders that would say, yes, I am fine with your policy brief, please go ahead. This is not the aim of a policy dialogue, or else we will not have a good discussion. However, every single stakeholder that you get to the policy dialogue, and you will discuss that tomorrow, you will have to do a stakeholder mapping for. So I would know before the policy dialogue, if I get the syndicate of hospital, they will be opposing every single option that I have, because it is not in their benefit to implement, for example, hospital accreditation standards, and it will cost them more. I usually every single stakeholder we have on the list, we identify if they are pro or contrary, or they have their own agenda when it comes to the policy dialogue. Once you have this as an initial step, this would really support in during the policy dialogue to address their concerns. But usually when you have a stakeholder that says, well, no, I don't think this option will work, it's very important to ask them why. And this is one of the reasons that you might have as a barrier, for example, for implementation. Sometimes they might say something that would make sense. So you need to tackle up the barrier itself before you start implementing the option. Or in the case of one of our policy dialogues, we invited someone from the customer protection in Lebanon. And before the policy dialogue started, definitely the facilitator welcomed everyone and was still not able to discuss the objective of the policy dialogue. This person stood up with a paper in their hand and started identifying that they are against this policy dialogue, that they wanted the list of stakeholders before they came to the policy. So they were very disruptive. But the facilitator in this case was very calm, very neutral. He mentioned that we will be explaining the objective of this policy dialogue before we proceed. Let us first identify, and everyone says their name, the institution that they're coming for, and still this person stopped the discussion and started screaming again, to the extent where the facilitator was still able to remain neutral. But at this point, the participants which were in the policy dialogue started to stop this person from talking and ask them to carry on with the policy dialogue. Sometimes there are cases like that. Sometimes you have people that tell you, well, this option does not work, it's going to cost a lot. You can ask them, so what can we do to ensure that this option will be implemented in the lowest cost? We're going to go in details of some of the facilitation tips and what can go wrong in a policy dialogue. And accordingly, you will also be informed of other issues that can go wrong also in a policy dialogue. Okay, so if there are no other questions, I will carry on. So stakeholder selection. Who are the stakeholders that you want to have on the table? You would want to have people who have their unique views and their experiences. Some people who are very well experienced in their field, the top-notch people, the head of institutions. You would also want people who are champions, who will carry on your options and recommendations, advocate for them for their implementation. You would also want to ensure that you don't get all stakeholders. So if you're having a national policy dialogue on a topic that is national and not regional, you would definitely want to have people coming from different regions of the country. You don't want them just all come from, example, so if you're working on a national topic, you don't want hospitals to come only from Jakarta, for example. You want to have a representation from different parts of the country and to have a balance across provider groups. So I wouldn't want to have 10 physicians and 1 nurse, for example, in the stakeholder dialogue. Just make sure you balance this out. Make sure you have a balance of gender also. You wouldn't want to be bombarded with the gender balance also. And make sure you have the stakeholders that will give you, that will guide you and provide you with constructive feedback when it comes to your policy brief. So those are some examples of stakeholders. For example, you have policymakers, you can have managers of healthcare institutions, managers of community-based organizations, members of health provider associations, representative of stakeholder groups, for example, like the consumer protection, researchers, national and international non-governmental organizations. Sometimes you might want to have patients, you might want to have citizens. For example, we were working on a child protection policy brief, and we had one of the mothers during the dialogue come and discuss, be part of the, someone who had a very extreme case with child protection. She was part of the dialogue during the national dialogue, national policy dialogue. So you want to have a mix and match of those different stakeholders. Sometimes based on your topic, you might not, for example, need a manager in healthcare institution, but this framework will provide you with more of a guide thinking of which and where do you want your stakeholders from. So this is just an example of one of the policy dialogues conducted at K2P on promoting access to essential healthcare service for Syrian refugees. In this dialogue, we had 28 stakeholders. Usually this is a big number when it comes to dialogues. We had policymakers, decision makers from ministries, Ministry of Public Health, Ministry of Social Affairs. Please, when you're having ministries during the dialogue, make sure that you don't have more than a maximum of 2 from the ministry, because then the discussion will be very skewed. And make sure you have the decision makers from those ministries. We had also UN agencies, WHO. We had also international organizations, non-governmental organizations from local community, primary care directors. So you notice there's a mix of different stakeholders. This is another dialogue that we worked on improving prescribing patterns for pharmaceutical drugs. In the case of policy dialogues, make sure you don't have media in the dialogue, because there's the Chatham House rule that we implement in the dialogue, where we do not align any point that any of the stakeholder raises with their name. And having the media during the dialogue would really diminish that, because they would want to get scoops out of the policy dialogue. Some stakeholders might not feel comfortable discussing when a media is available. So you want the ground to be as neutral as possible. And after the policy dialogue, you can have some media discussions and interviews. And Ryan will be discussing this section tomorrow on media engagement. So when it comes back to your topics, I want each one of you to just give me an example of some of the stakeholders that you think would be valuable in the policy dialogue.
Silakan Pak Kasman, Pak Stefi, dan Mas Angga. Ada stakeholder tertentu yang sudah ada di kepala, yang mau diundang siapa saja?
Yes, for my topic stunting, I will invite government officials, the health office, but based on the discussion with the expert in the previous session, I think I will also invite representative from non-government organization, as there are many non-government organizations working in the same topic that I choose.
Yes.
Also, I will invite people from university just to have their thoughts and also back up my policy brief if there is any contra or argument from the government official.
Great, great. So you're working on maternal and child health, right?
Stunting.
Stunting, yes.
Exactly. So it's very important also to have healthcare providers, sometimes physicians also at hand, pediatric nurses also, because I don't know if you have community healthcare centers also, but because they see those cases coming to their healthcare organizations, this is an idea for you to keep in mind when it comes to selecting the policymakers. You always need to think of your policymakers similar to your underlying factors. Who are those that will be working on the governmental level? Who are those that will be working on the financing level? And who are those that will be working on the delivery level? So is it some of the stakeholders that might be involved in the screening, for example, in the initial screening, or in the next step of management and treatment, for example? Who are those that will be taking the major national decisions when it comes to stunting? So those are things that you might want to keep in mind when you're selecting the stakeholders, but definitely you would want NGOs, you would want government officials, very important. Other topics?
Yes, Clara, I have some questions.
Yes.
The first one is, should we invite the national government also? Because this topic is national, it's become the main concern from the national level. Just in case that maybe the province government want to refer to the national government about the steps that they should take from based on the policy brief. Also, what do you think if we invite the patients or maybe beneficiaries? For example, in my topic, it will be the parents that the parents who have stunted children, just for supporting the ideas that I present in the policy brief. Maybe when they speak, the government will have more understanding from the patient perspective. Thank you.
Yeah, great question. So okay, so I'm going to be addressing the first one first. For the national government, definitely you need someone from the national government. If that means the Ministry of Health, for example, it would be great to have them also, because at the end of the time, when it comes to developing national decisions, they will be the person who will be developing the national decisions, and you would want to have them on board when it comes to developing or taking on decisions like that. When it comes to having patients, parents during a policy dialogue, it's very important, but just keep in mind that you don't want to over have those parents in the dialogue. What we usually do is before the dialogue or when we're developing the policy brief, we have small focused discussions with a group of parents who have children, for example, that have faced an issue with stunting and all of that, to get their info on what are some of the barriers that they faced, what are some of the facilitators that supported them or supported their kids to take good care, management, and treatment for the stunting of their child. What do they expect from the government to be providing them? So they would give you ideas of what needs to be done and what are some of the challenges that they faced. Based on those, you might select one parent which was the star parent in the discussion and have this person come to the policy dialogue. This is exactly what we did. For example, we had a topic working on children with disabilities. So we had a discussion with a group of around 12 parents that came and discussed some of the issues that they faced when identifying their child that they had the disability, when they had to access care, what happened to their child, and all of that. One of the parents was a star parent who was very vocal, was able to discuss the issues that they had in mind, that knows exactly what they want when it comes to the care of their parents, for the care of their child. So those are the people that you would want to select for your policy dialogue.
Okay, thank you, Clara. Pak Kasman, Mas Angga, do you have any idea siapa stakeholder yang mau diundang?
Okay, Clara, thank you very much. For my topic on tuberculosis, that empower the community for increase the case finding, I plan to invite the health office from the West Kalimantan province, and then the local leaders of the village, and then I think I plan to invite the from the Ministry of Health that concern in the tuberculosis issue, and from the community representative, I would like to I plan to invite the former TB patient, and from the primary health care representative.
Very interesting. Now, is your brief, does it include anything educational, for example? Do you want to include anything in the education system or not?
I think I'm not planning to invite from the education, like from the academia. But if you think I should, I will make. I will plan to invite them.
Okay, great. So those are good ideas. You might. So yes, go ahead.
Yeah, I have one question for you.
Yes, go ahead.
For the policy dialogue, who will the side to propose this policy dialogue? Is from the from me, from the researcher, or from the health office?
So it's definitely the person who's working on the policy brief who would suggest. So if you really want to ensure that your decisions are taken forward, you need to implement knowledge uptake options, which you would you will be informed of today and tomorrow. Because without it, eventually the policy brief that you have developed will just remain on the shelf and no decision will be taken. So ideally, a policy dialogue will be the best option to start with. And usually it is done, it is decided upon by the person who's working on the knowledge translation product. And you would also want usually a collaborator or someone who would support you in the policy dialogue. So for example, in your case, empowering the community for TB, for example, you would want to, definitely after the fellowship and all of that, if you want to carry it on to the next step, you might want to see if the Ministry of Health is interested to be a collaborator on this topic. And this can be done initially also from the beginning. And then you will be planning the policy dialogue, inviting the stakeholders, getting them all to confirm and getting them all to the table. In our case, for example, sometimes we have products that are not done in a collaboration with anyone, but still we do a policy dialogue on the topic. So the decision goes back to you. It also, this list of stakeholders goes back to you, but deciding on the right stakeholders would really make it or break it in a policy dialogue.
Okay, thank you, Clara.
Pak Kasman, ada bayangan kira-kira stakeholder yang mau diundang?
Halo, Assalamualaikum.
Ya, silakan Pak.
Halo. Maaf, signal juga belum terlalu bagus. Kami dengarnya cuma. Saya mencoba menarik tadi kesimpulan bahwa apa yang disampaikan oleh Clara. Kalau melihat daripada topik kami tentang National Health Insurance, lebih tepatnya di Kota Parepare, mungkin ada beberapa tahap Mbak Sita. Kalau kami biasa melakukan policy brief, tahap awal tentunya untuk lingkungan intern kami, stakeholder dari dalam pemerintahan itu sendiri. Jadi mungkin dinas sosial, masalah masyarakat miskinnya tentu datanya harus bersumber dari dinas sosial sebagai satu pintu, satu data untuk masyarakat miskin. Kemudian juga dinas kependudukan tentang validasi data mereka. Kemudian dinas tenaga kerja, tentang keuangannya tentu kita akan mengundang Badan Keuangan Daerah, dan untuk kepesertaan tentu kita mengundang BPJS. Jadi ada dinas sosial, dinas kependudukan dan catatan sipil, dinas tenaga kerja untuk mereka yang PBU penerima upah, kemudian BPJS dan Badan Keuangan Daerah. Itu mungkin langkah awal. Jika kita sudah sepaham di internal kami, dengan opsi-opsi yang 3 tadi kita tawarkan, kita permantap dulu, mana kira-kira yang lebih besar peluangnya, kemudian kita akan bikin insya Allah tahap kedua, yaitu mengundang stakeholder eksternal kami. Mungkin disitulah kami mulai memasukkan NGO, media, mungkin kami juga akan mengundang akademisi yang selama ini kami pernah lakukan, dan juga melibatkan masyarakat penerima manfaat. Jadi mungkin kami akan mengundang perwakilan masyarakat miskin yang DPKS kali 2.400 yang tidak aktif BPJS-nya, kita undang sebagai salah satu atau 2 mereka sebagai peserta pertemuan. Jadi itu Mbak Sita yang ada di benak saya, bahwa sebaiknya sebagai birokrasi saya harus meeting 2 kali pertemuan untuk stakeholder intern kami, dan kalau kami sepakat kita akan undang untuk stakeholder eksternal kami. Terima kasih Mbak Sita.
Terima kasih Pak Kasman. Sedikit klarifikasi Pak, yang untuk yang kedua yang dengan masyarakat dan sebagainya itu berarti lebih ke sosialisasi hasil dari kesepakatan pemerintahnya, begitu ya Pak ya?
Iya.
Oke, baik.
Mengharapkan seperti itu nantinya.
Baik, terima
Tapi
kasih.
mungkin dari sosialisasi kedua ini bisa saja muncul opsi-opsi yang kreatif dari LSM ataukah dari masyarakat sendiri Mbak Sita. Biasanya seperti itu.
Baik. Baik, terima kasih Pak Kasman. So, Clara, Pak Kasman, topic is on trying to expand the subsidized members from the poor people in the Pare-Pare district who are currently not covered by the national subsidy program. So he planned to do the policy dialogue in 2 steps. The first one is for internal stakeholders. So in order to get accurate data on the poor people and verified it, he would like to invite the social office. He would like to invite the population and civil registration office. He would like to invite the labor office, regional financial agency, and also the health administrator, the administrator of the social health insurance. That meeting would try to get all the internal stakeholders agree on the policies. And then the second step would be talking to the community. So he would like to invite the NGO, media, academicians, and also the beneficiaries. Back, over to you.
Great, thank you so much. So just to clarify something, now a policy dialogue, usually you would want to do it once you have all the information finalized. What you're thinking about is very important because you want to make sure that you get the right information from everyone. You might want to do this also during a litmus testing. And what's a litmus testing? It's usually you take the outline of your policy brief, what you have already done right now, but a bit fleshed out with more information, and then go to around 8 to 10 stakeholders to identify additional information, data that they might have, anything that you can add to the policy brief. Once you have this finalized, you can go back and have a full-fledged policy dialogue. But then again, I mentioned once again, make sure you don't have media in the policy dialogue. Because if you have media in the policy dialogue, then this might be a very big issue for your stakeholders. They might not provide you with the information that is needed. And this would be an issue when it comes to decision making. So you can have those 2 phases, but divided into one, which is more of understanding the current situation, understanding the current system, what are some of the barriers in the system, what are some of the challenges in the system, which is the litmus testing, which is taking your current draft brief, a shorter version of it, going to individually to the stakeholders. You can also have it in a small dialogue also to discuss it with everyone. And then after that, you can have the full-fledged policy dialogue with the different stakeholders that you already mentioned. Okay, great. Any other questions? Okay, so just to provide you with some facilitation tips on the dialogue itself, I know this might not be enough for you right now to facilitate a dialogue, but just to give you more of an idea of how a dialogue is usually facilitated. First of all, as a facilitator, you need to introduce yourself, provide a brief overview of the center that is hosting this evidence-informed decision-making process, disclose any potential conflict of interest that you might have, outline the rules of the policy dialogue to the participants. For example, if you want each and everyone, if anyone wants to talk, they might want to raise their hand first, or you might have tents in front of you that they might flip if they want to have to talk. Ask participants to introduce themselves, reflect on the pre-circulated document. Definitely before every policy dialogue, you need to have the document pre-circulated, send it out to everyone so they can read it before they come to the dialogue. You need to clarify some of the rules. For example, what's the Chatham House rule, for example, that you might not associate any name with any statement that comes out. You need to identify if the aim of this policy dialogue is to reach consensus on any of the options. So for example, do you want them to agree to move on with one of the decisions, for example? Encourage the participants to be active, respect each other and the differences that they have for each other. You need to mention that not everyone might have the same views on the table, but the end product of this is to really come up with options that are implementable, that are context specific, and that can actually benefit the community. Speak by turn, and also discussions should be directly with the facilitator, not the participants. Because in this case, when they are directing the discussion to the facilitators, it would be better and neutral. Whereas if they are having discussion across the participants, you might have some of the participants that do not agree on a certain topic, and this might light up quite a fire in the policy dialogue. Also ask for clarifications or examples. So for example, if you don't understand a certain statement that the stakeholders have mentioned, ask them, so can you please give me an example on how this can be implemented? Encourage the participants to use jargon-free. Sometimes you might notice that physicians or also healthcare providers might use some terms that are not understood by the main community, and this might be an issue. So not everyone in the dialogue might understand what's going on. Focus on the ideas, not the persons. Definitely keep in mind that it's not the person that we are discussing in the stakeholder, but we're discussing the idea that this person is providing. Push definitely to tangible oriented steps. Create a friendly environment, demonstrate neutrality. The facilitator should be a neutral position person, someone who is not affiliated with any organization that might be pro or con a certain topic, someone who is able to provide with neutral discussions among the stakeholders, someone who will not take sides in the discussion. You are, at the end of the time, you are discussing a problem and you want to come out with options. You are not enforcing any options on any of the stakeholders. You're just providing the evidence, and then the stakeholders are to provide which options they would want to move forward when it comes to decision. Make sure to sum up the discussions after each section, and then remind participants to stick to discussions relevant to the section only. Sometimes they might go off topic and discuss things that do not make sense, or discuss other topics. Make sure you get the stakeholders back to the initial topic. Okay, so some of the issues that you might face during a dialogue is that some participants are not available to attend. So, and some of those participants might be very important and you really need them during the dialogue. So make sure you plan properly in advance. Make sure, for example, the dialogue date does not fall on a public holiday. Provide stakeholders with at least 1 month notice that the dialogue would take place on this specific date, so they can book this in time. Because some stakeholders are very busy. They might not be able to find the time the last 2 weeks of the dialogue. Participants are not equally represented. So for example, you might have 5 from the Ministry of Health and then 1 from the Ministry of Finance. Then that might be an issue. Make sure you organize follow-up conversations with those that are underrepresented. For example, if you don't have anyone from the community, you might want to do a follow-up conversation with those people. High-level participants decline participation last minute. Definitely organize a follow-up meeting with this person. The organizing team does not send out the full policy brief or briefing note, but only the executive summary. Always apologize for that, and make sure you clarify and clarify the mistake that has been done, and make sure that you explain in details the policy brief that will be discussed. The majority of participants have not read the pre-circulated policy brief. And this is one of the major issues we face in policy dialogues. Although we send the policy dialogue 3 weeks almost 3 weeks before the policy dialogue takes place. Some policy makers, some stakeholders still come to the policy dialogue and have not read the policy brief. So in this case, you might want to have more of an introductory section at the beginning of every single policy dialogue that you have to discuss the policy brief. For example, you can discuss the problem statement. You can open up discussion for the underlying factors, give a general brief about that, just to make sure that everyone is on the same table when it comes to discussing the policy brief. Other issues might be that you have the wrong people in the room. Make sure you prevent it by preparing very well ahead of time. Identify the stakeholders that you really need in the policy dialogue by name and by person and by institution. Some participants dominate the deliberation, and this is the main issue. Watch out for those people. Sometimes you know those people will dominate the discussion from the beginning. Make sure you ensure that everyone knows that if anyone wants to discuss or say something, you have a rule for it during the policy dialogue. If a participant keep on interrupting, give them a minute or two to express themselves, but then emphasize that at the same time, you really need other participants to give their opinion, and watch the clock to keep track. Please make sure that if you tell them that the dialogue will take 1 hour, it means it will take 1 hour. Don't go beyond that, just to ensure that you respect everyone's time. Another issue is that the participant contribution is irrelevant. They might jump totally off topic, so you might want to interrupt them or reframe their discussion in a way that fits back into the topic at hand. An individual insults you, stirs up trouble by saying these policy options do not make sense, and this policy dialogue is a waste of time, and this is a major issue that you might face with some of the stakeholders that are arrogant sometimes, so that those that might want they have their own agenda, for example. So in this case, ask the participant to reflect very briefly on why he or she thinks that. So if they say that, so ask them, so why do you think those policy options don't make sense, and how can we improve them? Refer to the policy brief and emphasize that in preparation for the policy dialogue, high-level individuals had the chance to comment on it, on the options, and that no doubts had been mentioned then. So be very extensive and systematic with the process that you use for developing the policy brief. And if you are very extensive and systematic with the methodology, you might not have an issue with any of the stakeholders in that. And you will also have more of an armor in when it comes to some of the stakeholders saying that. So you might mention that before we finalize the development of the policy brief, we have met with the Ministry of Health, we have met with the community, we have met with key stakeholders of the educational system, physicians, and so on. Many of which stakeholders that will be during your dialogue, you have probably met them before, because when you develop your summary outline of the policy brief, you will go and meet with some of those stakeholders to get their input on the options, on some of the barriers, on some of the data that they might have, some of the underlying factors leading to your problem, and even on your problem statement. So all of those you would have already discussed with some of the stakeholders. So a participant makes an unconstructive self-serving comment. Put the individual back into his position by showing his or her comment as what it was, as self-serving. So you can tell them, I can see how you would find this to be a very helpful way forward, because clearly it would bring resources to your group. However, this and that, how it's going to go. And this also happens with people which have their own agenda. You want to reflect on that, make sure they know that this is based on their agenda, but you would also want to complement it in a way that is still respectful. Use other participants and your own power of observation to get back to the agenda. So you can ask 1 or 2 other people in the room So what do they think the policy dialogue has gotten to, which can immediately put into contrast to what the unconstructive voices stated. So sometimes you might ask opinions of other people to tell you, for example, what do you think about this person's comment, and how can we build on that, or does it fit within your personal agenda? So other options, there are also people who get aggressive, try to calm them down. Don't engage in discussions that are getting out of control. Steer out of that. Participants are angry with you. Make sure you don't get emotional. Control your emotions. Take a deep breath as much as possible. Sometimes it really gets out of hand, so you really need to be calm when it comes to facilitation of a dialogue. During a policy dialogue, it turns out that the real health or policy problem is different from what you have in the policy brief. Make sure your discussion is very extensive previously with stakeholders. You have done the literature review well. Know what options are feasible from the policy perspective. Remind the participants on something that's very important. During a policy dialogue, the policy brief is not final, because after the policy dialogue, stakeholders might inform you of additional information that you want to integrate within your policy brief. So make sure you inform them that any option or any suggestion that they provide will be taken into consideration into revising the policy brief. Again, timing, we have already mentioned. So some lessons learned. As a facilitator, you can make it or break it in a policy dialogue. If you have aggressive people in the dialogue and you tend to attack those people, everyone will leave from the policy dialogue. We will not get anywhere. You have to understand the context in which you're discussing. The participants that you have, you need to study them very well, understand their positions, respect policy dialogue processes, be very well prepared. 80% of everything that you do or the success of the dialogue would really come into your preparation. A different set of skills are important. So skills in conflict resolution, managing politics, and all of that is really important. Try to be concrete about tangible next steps. So once the policy dialogue is finalized, you might tell them, so given all of the discussion, what are some tangible next steps that we can start implementing? The opening of a dialogue session is critical, so make sure it's transparent. You introduce yourself, you provide this overview, explain the purpose, the outline the rules, provide a brief rationale for the selection of the participants, and then conduct the dialogue. Is quite not enough bringing research into policy, but there's also need for follow-up activities after the policy dialogue. So mainly this is it when it comes to a policy dialogue. You definitely might need to follow up with some stakeholders after a policy dialogue, just to make sure that they are implementing what they said they will be implementing, and make sure you select your stakeholders very well when it comes to the dialogue. So now that the presentation is done, I will open up for discussion. If anyone has any questions about the policy dialogue, I will be happy to answer.
Thank you, Clara. Bapak-bapak sekalian, mungkin ada yang ingin ditanyakan atau ingin diklarifikasi dulu ke Clara?
Dari saya cukup, Bu.
Terima kasih, Mas Angga. Pak Stevi, ada yang ingin ditanyakan?
Untuk sementara belum ada. I have no question for now.
Great, perfect. So just in case anyone has any questions, I'll be ready and happy to answer. We also have part of our team tomorrow providing you with knowledge uptake options, for example, other strategies that can be implemented. They will be also able to answer you if anything or any question comes up on those phases. Sita, do we still have some time to address any questions in general that the participants might have?
Yes, we do.
So I just wanted to ask if you have any questions when it comes to the whole process of developing a policy brief. And if you have any unclarities when it comes to developing your options, where to find the evidence, what kind of underlying factors that you need to keep in mind, and all of that.
Jadi sekarang yang bisa ditanyakan bukan mengenai sesi yang tadi, bukan mengenai yang policy uptake dengan policy dialog ini, tetapi lebih kepada proses dari penyusunan policy briefnya itu tadi. Apakah Bapak-Bapak ada yang ingin ditanyakan mengenai tadi bagaimana cara mencari atau menemukan kata kunci yang tepat untuk option yang ingin ingin dimasukkan ke dalam policy brief, bagaimana proses menyusunnya seharusnya seperti apa dan seterusnya. Kalau ada yang ingin diklarifikasi atau ingin ditanyakan atau ingin minta dijelaskan kembali, boleh silahkan. Saya kalau nggak salah ingat Mas siapa ya, Mas Angga atau Pak Stevi yang menanyakan mengenai penelitiannya. Kalau datanya tidak ada yang dari daerah sendiri, itu bagaimana? Saya lupa, tapi itu siapa?
Oh, itu Pak Stevi kayaknya.
Ya, Mas Angga ada pertanyaan, silakan.
Oh, Oke. Thank you, Bu Sita.
Yes. Any question, Pak Clara, Pak Angga?
Yes. Do you hear me?
Clara,
Hello?
can you hear us?
Yes.
Yes, okay.
Sorry?
Silakan lanjutkan, Pak.
Okay, I would like to how to make a problem statement. Do we should use the current data or there is a limited time for data? Thank you.
Yeah. So it depends what you want to show. Is it a trend that you want to show? For example, in 2000, in year 2000 for 2010, for example, I wouldn't go beyond 10 years unless there's an adequate necessity for that. The number of tuberculosis, for example, was 23,000. And then in this year, you need to show a very current year. For example, 2020, 2019, 2018, those are current years. You want to show if there was an increase, definitely you would want to reflect on the data that is available right now for the problem statement.
Right, thank you very much.
Terima kasih, Mas Angga. Pak Stevi atau Pak Kasman ada yang ingin ditanyakan?
Okay, maybe I want to ask a little bit further. After we have a policy dialogue, I mean, we already have our policy brief. We conduct policy dialogue with the policymaker, and we have a good discussion, and they maybe just say that they receive our policy brief with some consideration.
Mm-hmm.
And then what do you think we should do? I mean, do we have any methods to monitor the policy brief if it's adopted by the policymaker or not, or what should we do after that? Because maybe when we invite them to the policy dialogue, they say that, oh, this is very good, and then we will do it. But then after they get back to the office, other things come up, and then they forget, or they don't have any funding for the option, or I just curious, like, what should we do after that? Thank you.
Yeah, very important question. So during the dialogue, sometimes you might come up with some champions that might say, well, I will carry on this option and follow up on the implementation, or develop a small group of the different ministries to carry on one of the options. You might want to follow up with those people to identify where they're at when it comes to implementing those options. But this goes back to you. Do you want to monitor and evaluate the implementation of the different options, or do you want your role to stop when it comes to developing the policy dialogue itself? At K2P, we usually follow up with the stakeholders. We give them a margin of 6 months because sometimes the funding is not available. Sometimes they want to carry on the team for this option. Sometimes they want to, they have other things going on, so they need some time. And sometimes it happens right on spot. The decision is taken and then one of your options is implemented. For example, in one of the dialogues on palliative care, the decision from the Ministry of Health was to subsidize palliative care in a governmental hospital. So they said that they will be working on that. After 2 weeks from the policy dialogue, they took a decision on subsidizing palliative care in governmental hospitals, and this was publicized in the media. So this is one of the more of the successes of the policy dialogue and one of the successes of the options that was suggested in a policy dialogue. But there is no one size fit all when it comes to that, because sometimes decisions are made by law, sometimes it is made by internal regulations, sometimes it's just made by implementing practical options in a certain institutions. But you will only be able to know that if you do a screening of what is published when it comes to the media, for example, on your topic, and you will be discussing that on media engagement when it comes to tomorrow with Rayan. And following up with your star stakeholders when it comes to the options that you have in mind. So this is the best way and the easiest way, in fact.
Thank you, Clara. Sudah cukup jelas, Pak Stevi, atau mungkin mau diperjelas lagi?
Yes, thank you. Thank you for the information. So 6 months, right?
Yes, around 6 months, just to make sure they have sufficient time to implement.
Okay, thank you. Pak Kasman, ada yang mau ditanyakan?
Okay, seems we don't have any further questions.
No, I don't think there.
Yeah. Okay, great. So to that end, I'm going to tell you thank you so much for today's session. It was very great. Your questions were wonderful. I will be following up with you after the course is finalized with the team. And also, if you have any questions, please feel free to ask me. Would be happy to do so. I will also review the outlines that you have provide you with additional comments so you can move on later on with developing your full policy briefs. So best of luck and good luck for tomorrow. It's going to be a very interesting day tomorrow and very exciting with advocacy, media, with the stakeholder mapping. So looking forward.
Thank you very much, Clara, for your time and for your insights on the policy dialogue. I think it's a very, very, it's an eye opener, I think, for some people. Because, sometimes we thought we already know something about policy dialogue, but at the end of the day, it's probably not the best way of conducting a policy dialogue. And now we know from your experience that there are, you know, a bit more systematic and structured way of conducting a policy dialogue. So thank you for that. So Bapak-Bapak, terima kasih banyak atas waktunya setelah mengikuti sesi dari tadi pagi, setelah presentasi, kemudian mengikuti sesi siang hari ini. Kita akan bertemu kembali esok pada pukul 10 waktu Indonesia bagian Barat untuk memulai lagi webinar kita. Ada beberapa topik yang akan dibahas, stakeholder mapping, kemudian media dan juga advokasi, dan saya rasa ini hal-hal yang sangat penting untuk kita ketahui bagaimana cara kita menindaklanjuti atau membawa policy brief kita menjadi lebih mungkin untuk diadaptasi atau diadopsi oleh para pengambil keputusan. So thank you again and we'll see you tomorrow. Have a good day, everybody. Thank you.
Bye-bye.
Bye.